Professor Adrian Liston is professor of pathology at the University of Cambridge and a quality fellow at the St. Catherine's College. He's highly published in immunology, and especially his work on regulatory T cells in the brain and manipulation of the population for therapeutic benefits is it's very well known. So he's been awarded with a lot of fellowships, among which we have the fellowship from the Academy of Medical Sciences, the Franke Chair, and the Eppendorf Prize. And beyond this research, also Professor Liston is a prolific writer and workshop coordinator on the topics of navigating science career and improving research culture. And finally, and this I find very interesting, so I will have a question about that later, that Professor Liston writes several illustrated books for children and design educational computer games. This will come later on a question. But Professor Liston, the floor is yours. Yeah.
Thank you. Thank you very much. It's a pleasure to be here, and I think it's really a fantastic endeavor to connect people through this program. So what I would like to talk about today is building a positive research culture, and in particular to try to give some tips as to how to create that culture inside your team. I think it's normally pretty clear to people what a negative research culture is or what a toxic research culture is. And yet it's harder, I think, to define what a positive research environment is. Often we know a place that we enjoy going to, we know a team that feels good to us, but it can be difficult to define. Now, for me, the definition of a positive research environment is one where all the team members are empowered, they're recognized for their contributions, they have a clear career trajectory, and that they're able to contribute to research that is both impactful and reproducible. Now, often when I give a talk on positive research culture, I have to really justify why we should be focusing on research culture. And to me, this is quite an odd question. I mean, I really think that if you don't want to make the lives of your team members better, then you shouldn't be becoming a leader just from an ethical point of view. So I think that that argument is actually the most important. If you're going to have a position of responsibility, then part of your responsibility is to make your team members' lives better. But if people do need extra convincing, I think there is also a strong utilitarian argument for focusing on research culture. And a lot of this comes down to if you focus on research culture up front, you're going to have a team that is going to be more productive and easier to manage. So I think it's pretty clear that if people are happy where they're working, they're going to stay longer and improve staff retention. It builds up skills. The longer people are around, the more they know how systems work, the better relationships they've got with other people, and things work very smoothly. I think it's also pretty clear that if you have an environment where people all feel like their opinions are valid, their input is respected, they're more likely to speak up, and you're more likely to get ideas that are coming from all different sources. And this really, I think, improves our creativity. It's pretty clear that happy teams are more productive when people are like working with each other. They're more likely to chip in and help each other on that difficult experiment. If they have difficulty troubleshooting a protocol and they're having a good sit down and a coffee with other people in the lab on a daily basis, they're more likely to talk over their problems with other people and they get solved better. And then finally, I personally think that managing a positive team is so much easier and so much fun. So I think that we shouldn't ever fall for this false dichotomy that is sometimes put up, that you can either pursue excellence or you can pursue kindness, but you have to choose one or the other. to me, actually, you should be leading with kindness, leading with trying to create that positive research culture, because it actually makes excellence easier to pursue down the track. So this next part of the talk, I want to focus on some practical tips to improve the research culture in your team. And I think there are lots of different ways we can do this. There is no perfect team. Yeah. Research culture excellence is a constantly moving target. Expectations are changing, strategies are improving. We can always work on our own practice. So I think no matter how good your environment is, you can think about things that you could incorporate to try to make your environment better for your team members. Now, one of those tips is to be transparent about your expectations. I think that often a lot of the problems that arise in a lab arise from a mismatch of expectations between the PI and between the lab member. And one of the ways that you can really minimize this is just to really be upfront about what you expect. Now, I give out a expectations document to everyone who's even thinking of joining the lab. The first thing I do is respond with an email saying, this is what I expect from a team member. This is what I expect to give to that team member. And if you're interested, you can follow that QR code. Feel free to modify it and communicate your expectations to other people. But I think it is really important to, when you write down your expectations, reflect on whether or not you're really being honest. Because I think there's often the values that we would like to hold and the values that we actually hold. And part of being really transparent about your expectations is being honest with yourself and also reflecting on whether or not these are reasonable things to expect. And maybe we need to change what our expectations are, dial them back. And sometimes we need to just be upfront with ourselves about what we actually want. I said I communicate these in advance to my potential recruits. I try to reiterate them multiple times during meetings. And I think it's really important that both sides have to try to live up to them. So if you're joining a lab and there are expectations that are put forward for you, it is good for you to try to meet those. And there should also be expectations on your supervisor and on other team members, and they should also be trying to meet their expectations. If I've made a commitment to try to meet with people, I need to live up to that. If I've made a commitment to try to support people's career development in multiple different directions, again, I need to try to live up to that expectations. And then finally, I think it's important that these expectations need to align with the other values of your lab. If you are talking about, if you say that it's most important to you to have people act well as a team, and that what's really important to you is that people are scientifically rigorous and they're good team members, you need to make sure that your promotions, your contract extensions, your rewards to team members, they align with those expectations. And you don't have a situation where you're telling people your expectations are one thing, but you're rewarding a separate set of things like high impact publications. You have to be honest about that with yourself and with your team members. Another thing I think is really important is to really know your team and to celebrate your team. So this is, if you go through that QR code, it's a book that I wrote about my team members here in Cambridge. And I go through all the team members of my lab at that point, what their motivations were for becoming a scientist, who their role models were, and what type of hurdles they had to overcome. Now, that's kind of an extreme case. I don't expect everyone to go and write a book about their team, but I think it is really important that you understand that your people are people. They're not a job description. They're not a cog that has to fit the program. If you take the time to understand people's motivations, it's so much easier to align their job to their motivation. If someone's coming in and they are really keen to go into industry afterwards and they really want to get into the biotech sector, all it takes is sometimes a small modification to their project that lets them have a bit of experience at interfacing with industry, maybe aim their research so that they get a patent as well as a paper. And sometimes you can see that interest people have in their job absolutely explode because their job is now aligned with their motivations. And you can only do that if you really take the time to know your team as people and to try to create a job around them. Now, the third tip I've got is that I think it's really important to know yourself and to communicate that knowledge to other people. I think it's important to know, what makes you tick and what your bugbears are. If you're someone who is really cranky in the morning before 10 o'clock and you've had your coffee, then let people know that. Don't book meetings with people during your cranky period. Have that as your solo working time, and book meetings in your after coffee glow. Um, I try to put in the lab guide that I've got for the lab, my particular bugbears so that people know that up front and they can work around it. I think it's also really good to be able to, if you know your own bugbears, you can hire to your strengths and try to not accentuate your weaknesses. I know that I'm personally much better at dealing with people who are underconfident than at dealing with people who are overconfident. I really quite enjoy that process of taking someone who is underconfident and building up their self-confidence, and building up their belief in themselves. Whereas when I'm dealing with someone who's overconfident and I have to rein their enthusiasm back down a bit, I find that to be a process that is emotionally draining. So I don't enjoy that interaction as much, and I tend to start avoiding it. And so this is something that, knowing about myself, I can hire to my strengths. And there are a lot of different ways that you can improve your communication. I particularly like this book from John Gottman. It's about marriages, but it's a very scientific approach to analyzing different types of relationship interactions and how they lead themselves to long-lasting relationships. And really, a professional relationship can last just as long as a marriage if you've got good lines of communication that make they very clearly indicate what you want, and also that you understand and listen what other people want. And I think this is really particularly important in science. I mean, this is a general management, communication is a general management issue, but I think it's particularly important in science because I do think that the average scientific PI is really overtrained in criticism and undertrained in giving compliments. And it's probably an occupational hazard. We are trained to come up with our ideas and hypothesis, and then we're trained to try to destroy that hypothesis. We're trying to prove ourselves wrong. We're looking for flaws in our ideas. We're trying to look for signs that we've overinterpreted our data. We review papers and grants with an idea of trying to find the problems and point them out. Now that's okay when you're talking with scientists who have got decades of experience in constantly being criticized, but I think it's particularly difficult when you have new young investigators that are entering into science and they don't have that long experience of just getting constantly criticized and not getting complimented. And so I think we do actually need to retrain ourselves to be much kinder, to try to acknowledge positives rather than just focus on the negatives, and really try to improve our ability. And it's not something you do once, you have to do it constantly. And remember that you've always got new people coming into the lab and you've got to build relationships with all of them. Now, in terms of different ways to build relationships, I personally think that building traditions is a very valuable way to do it. An example of a tradition would be the German hat tradition that we've got in my lab. These traditions can be used to signal your values. And one of the values that I've got is that science is slow and that we don't make progress as solo efforts. We make progress because of the cumulative impact of teams. And so I like to have traditions that say that you're not running a solo marathon. You are part of a relay race. You're moving science forward to give to the next person. And together we're going to win that relay race. We are going to make a difference, but we're not doing it by ourselves. And so I think that's kind of the value that I try to bring across in traditions. An example of a tradition that I have in the lab is the golden pipette. This has been going on for a decade now. And so this is given to everyone. It's given to people once a year, and then their name goes on a plaque, and people can look at the list of different winners that have been in the lab over the last decade. And so it's got that sense of tradition and that sense of legacy that we're following in each other's footsteps. However, I think that when I originally designed this golden pipette, the the award was given for the best experimental result of the year. And actually, in retrospect, I think that is a toxic behavior because people don't really have a whole lot of control over how interesting the result is, how good the result is. And so I think that then rewards essentially luck, and it tells people that you have to get a good result. And that's not really how science works. So once I realized that that was not a positive behavior, it's quite simple. I just changed the behavior. I changed the way the award works. Now we give out the golden pipette for being a positive member of a team, for helping bring out the best in other people, for elegantly designing experiments. Okay, and really I think that design of the experiment is the key part. Whether or not the experiment gave you an interesting result is not the point, because that's outside of your control. But your ability to design an experiment that is elegant and informative, that's inside your control. And there's tons of different traditions that I've seen in different labs around the world. Some people have a wall with postcards from team members that are going away. I know a lab that has got a little toy mascot that anyone from the lab takes with them to conferences. Maybe you have a communal fika or a coffee break once a week. I saw a lab that had a wall of failure that I really liked, where when people messed up an experiment, like a terrible Western blot or something, they stuck it up on the wall. And I thought that was a really great way to tell new people coming in the lab that it's okay to fail. We all fail. It's normal to fail in science. Lab dinners, movie nights. I mean, there's so many things you can do that make your lab feel like a team environment. And then the final tip here is to say that words really do matter. I mean, it's really important to people in your team that what you say is what they hear. Yeah, you can't expect people to understand what you meant and read your mind. We often cut verbal corners. We'll say things like, "Oh, we've got to repeat the experiment to boost the N and make the result significant." Now, what we mean is that we've got to repeat the experiment with a higher N that's got sufficient power to determine whether or not the result is significant. Okay, but when you make that verbal shortcut, even though you know what you mean, and some of the senior people around you might know what you mean, you have to remember that what people are hearing is you telling them to make the result significant. And especially if you are a new master's student, you don't have experience in the lab, you're listening to what people are saying, you're taking them literally. These things can be problematic. So really think about the words that you use. So just in the last few minutes, I want to mention that that there are ways that we can be proactive at avoiding problem behaviors. And I'm just going to go through this very quickly. But essentially, I think that people are not going into science with the idea of committing fraud or being problematic. We're going into science to try and make a difference in the world. And yet people do end up in a situation where they really do commit scientific fraud. And I think that the reason this happens is because there are a series of steps that you can take under stress that each step doesn't seem like a big deal. Okay, and these start with things like having overly high expectations. You go into a rotation thinking that your work in that rotation is going to contribute to a new medicine. It's not. It doesn't work that fast. And then you see other people around you that are getting good results, and you think there's something wrong with you, um, and you end up um, setting yourself unrealistic deadlines. Sometimes people say, "Oh, I'm going to submit to this conference um, in December. I'll just say now in the abstract, well, I've got this result and I'll get it by then, right?" Or people will set deadlines on you, and that can create extra pressure. Then you've got a situation where you'll start bluffing. The experiment didn't work. You don't want to admit that. So you just tell your PI, "Oh, yeah, the experiment worked great. I haven't analyzed it yet because I've been so busy." But secretly, you're thinking you have to come in on the weekend and repeat the experiment. And then you'll find people that just are unable to admit that they made mistakes. They feel like if they come forward now and say something, they're going to get kicked out of a program. And that's when people start doing this type of fraud. All right, I've done an experiment 4 times. Each of those 4 times had a problem. But if I merge the data from this one and the positive control from that one, I can use it as a placeholder experiment while I get the actual experiment to work. And at that point, you've slipped into the point of no return. And the thing is, if we just focus on that, then it's very difficult to um, to reverse this type of behavior. Instead, what we need to do is really focus in on these early steps. And I won't go into this because I'm already over time, but there are ways that we can have a positive influence on people at those early stage. Try to dial back expectations. Try to really show people that failure is normal and it's okay to make mistakes. Try to reduce pressure on people. Make sure systems are transparent. Make sure that people trust that when they make mistakes, you're going to respond well to those mistakes. And if you do all of these positive behaviors, you avoid people going down this chain to a scientific fraud situation. And I think just the final message that I want to say is that research culture is not something that is set by the team leader. It's not something that is set just by the PI. Yes, your PI has a big influence about it, but really everyone inside that team is impacting research culture in everything they do and everything they say and how they treat each other. And you have the ability to make a big difference for your team, for your culture of your institute, just by how you wake up in the morning and how you treat the people that you see on a daily basis. So I just want to finish by saying, thank you to my team. I've had a great group of people over the years, now at Cambridge, but before at Abraham Institute and VIB, KU Leuven, just lovely people to work with that have really taught me so much. And if anyone is interested in any of the career work that I've been talking about today, you can go to this QR code here. It goes to my website where I've got lots of different articles about different career problems and that are relevant to different career stages. So there might be something there that might be helpful for you. Thank you very much.
Thank you very much, Adrian. This was super interesting. So first small question, could you please share with us the QR code so we can send them on our WhatsApp group for people also that could not attend to learn all this valuable information later by email? Thank you. And then
Absolutely.
I had a burning question before going to Yana. Um, so of course it's important to have the to set the expectations, and as you very well said, science is low. However, usually university or doctoral schools are the first one to to force students to publish a certain amount of papers in order to have their PhD. So is it something you have to deal with in the past, or how would you deal with it as a PI?
I'd say it's not something that I've had to deal with
Mm.
in the past. So I did my PhD in Australia, Now I'm running a lab in the UK. Both Australia and the UK, they don't have a requirement for publications. Yes, your work has to be of publishable quality, but you don't actually have to have published. In Belgium, you've got the requirement of a first author paper, but it's just one paper. Co-first is okay. They're also fine now with a pre-printed paper. So it was never a problem. But there are systems that really do have a requirement for many papers. And I'm thinking here, for example, the Finnish system. And I would say that that is a structural problem that is a toxic behavior that is imposed by the university. And I think that those universities and the PIs inside those systems really need to strongly push back at those criteria. I think they are unhelpful. They're toxic. They're not good for anyone's careers. And they just need to be changed.
Yeah, I fully agree. Thank you very much. So I see there are other questions. I will park them for the moment, and we will switch to Yana so that afterwards we can go with the Q&A session. So Yana, please share your slides. So Yana, you won one of the ISV ISP awards last year during the conference. So this is one of the reasons you are here. You are from Ukraine and you started your PhD actually at the University of Kyiv, and you moved here because of the war in KU Leuven. I'm saying here because I'm also in Leuven, so this is why I'm a bit geographically related. And so please, the floor is yours. We're very interested to hear your story.
Okay, can you see my presentation?
Yes.
Okay, thank you so much for introduction, and thank you for Professor Liston for such a inspiring humanistic approach to the seminar. But I'm gonna switch a bit to practical what I have been doing, yeah, so I'm working on the pregnancy model and the effect of SARS-CoV-2 on it. And the topic is COVID-related inflammation of the placenta, and it causes the fetal development problems in the pregnant hamsters. Oop, I can't switch it. Yeah. So as we know, SARS-CoV-2 is a respiratory virus, but how do we connect it to the reproductive system, the pregnancy or neonatal life? And we know, sadly, that pregnant women are always a risk factor for like viruses, for infectious diseases. For example, in the context of SARS-CoV-2, pregnant women are indeed have a higher risk to be hospitalized, to get to the intensive care unit, to need for additional ventilation. As well for the babies, there is a higher risk to be stillborn, like meaning that they die before they being born, premature delivery. There's some respiratory distress after delivery. As well, now maybe some neurodevelopment delays, but the data still is coming. Also, the vertical transmission is like really rare, so it's like really maybe 1 to 3%. It's really anecdotal cases. As well, it affects the placenta. And nowadays, there is a term that is called SARS-CoV-2 induced placentitis. It's meaning that the placenta has necrotic areas, the fibrotic, and immune infiltration. But the placenta, we're going to get a bit later. So what objectives do we follow? So we want to investigate the impact of COVID on the pregnancy using Syrian hamster model. And if there are any effects, what can we do with them? Why do we use these animals? I mean, they're really cute, but moreover, they are easy model to handle. They're a small animal model. They are nature susceptible for the virus. They have really short pregnancy as well. So their pregnancy is only 16 days. And so firstly, we wanted to establish this model, like the pregnancy itself, because in our lab, we have a lot of experiments working with hamsters as a SARS-CoV-2 model, but pregnancies was new. So as you can see here on this graph, we have different time points where do we infect, and it depends on the really critical points on the pregnancy, what happens. So for example, at E0, it's when insemination happens, so we couple them. Then at E4 happens the implantation of the embryo itself. At day 7, the placenta start to form, and it should be formed by day 10. So we chose those critical time points to infect them because they are most relevant in the pregnancy. So we infected them with the alpha strain because it was the most, given its most clinical features for the infection itself, even though this ancestral strain. And we sacrificed them 1 day before the delivery. So all of these groups were sacrificed at E15. We didn't allow them to deliver because they can't control it, and they can also eat their pups if they are not healthy. So what we have seen that if we infect them early, like for example, day 0, day 4, they do tend to lose weight with a maximum at 7 days post-infection, but then they do recover. You see it on the graph. There are 4 time points, and in a gray shaded area is a control. So you see that even though they lose some weight, it's maximum around 7%, they do gain it back. And we don't see it if the infection happens later. But it's non-pregnant females also lose the weight. So it's not because of pregnancies they do it, but it's because of the infection as well. So further evaluates this and the effect of the virus on the lungs, for example. We have checked this after the sacrifice, we checked the lungs for the RNA and the infectious virus. And we see that at 5 days after infection, it's still a lot of viral load and also infectious virus. But 8 days after infection, they clear it up. So as well, pregnancy doesn't make it the virus persistent there. As well, we checked the lungs, and we see indeed 5 days after infection, you see the more like injury in blue, more injury in the lungs, and we checked it by the hemorrhages, edema, bronchopneumonia. But afterwards, they changed to the recovery of the like this pattern, and you see that more pneumocyte hyperplasia, plasma cell infiltrations, so the lungs start to recover. Of course, they have still lesions, but they do recover. And you can see it as well on the cytokine profile in the lungs. So in this, the first part is the 5 days after infection, and we see a lot of virus, or not a lot of cytokines, especially IP10, MX2, but 11 days after infection, it calms down. So we see that pregnancy, they lose weight, but they do recover. They have the virus, but they clear it out. Also, the lungs have the quite damage, but they heal themselves. But okay, so we see the pattern in the mother. What do we see in the fetuses? And in the beginning, we thought that if we infect them early time point, as it's easier when the implantation, like the insemination happens, so the peak of infection gonna fall on the implantation. And we did not see that there is effect any of the implantation or on the resorption. And you see it here, an example of the E10. So it's 5 days after infection or 15 days after infection. There was no effect on that. But interestingly, that's infection at early time points when the placenta not yet formed. We see, especially you see it here in orange with the E4, that the pups were significantly smaller than the non-infected counterparts. And we see the biggest effect, especially at this time point. And you can see here, it's a representative image of the pups. And you see in the mock, they were not infected ones. And the infection at E4. So it's all were sacrificed at E15. So in the end of the pregnancy. And you see that not all the pups were affected. So some are smaller, some are bigger, some are normal weight. So it's, for example, like in the mice most studies, they're going to show the effect on all of the progeny, all of the pups. But here we see that some are suffered and some didn't. And here we used like clinical way of looking at this stuff. So for example, if you collect all of the control non-infected pups and check their weights, you can define the small for the gestational age pups. It's like same for the human, small for gestational age, or intrauterine growth restricted ones. So if they are smaller than the 10th percentile. And these, for example, babies from in our case, they can have more tendency for the infectious diseases or like development delays or other problems in the future life. And we have tried to do it well here. And we indeed see that when infection happens earlier, before the placenta formation, the pups have higher risk to be, odds ratio higher to be small for the gestational age compared to the later time points. Okay, so let's return back to the placenta. So this is the like microscopic images of the human placenta that were from the infected like women, and which had the stillbirths. And you can see here that we observe this triad of fibrin, the immune cells, and necrotic areas. And you see these images that placenta looks like a scar tissue. So in those cases as well, it was affected more than 70% of the tissue. So meaning you can't properly exchange the gases and nutrients with the babies. So okay, maybe this is the question and this is our answer, what comes wrong. And we indeed observed that the placentas from the infected dams, especially at earlier time points at E4, was smaller than not infected ones. And okay, so let's check it further. And we checked for the RNA present in the placentas. Indeed, 5 days after infection, there is still RNA present in the placentas, but 11 days after infection, they are clear. So we don't find it anymore. Okay, if there is a virus in the placenta, where goes it first, like further? It should go to the pup. So we decided as a liver going to be the first organ connected to the placenta in the fetuses. So we expected, okay, if the virus in the placenta, it should go to the fetus. And we didn't see anything. So in our case, the SARS-CoV-2 is not vertical disease. It's not vertically transmitted for the pups. And here is an example of the hamster placenta. The big problem here with working with the hamsters that you don't have data about it. Maybe first or like the last published data about the hamster placenta is maybe 60s or 70s. So it's really hard to base yourself how to investigate it, how to work on it, how to count it. But we tried our best and used the mouse models, used some human, like the histological features. And as you can see here with the where GZ states it's a junctional zone. It's a maternal part of the placenta. It's where glycogen, it's where humoral hormones production happen. And labyrinth, that is a lower part, it's a fetal part where the gas exchange, nutrient exchange happens. And on the outside, you're going to see a bit reddish. It's going to be more deciduous. So this is the histology image of the hamster placenta. And for example, this is from the infected placenta. And you see that something goes wrong here. We see all these like red, pinky structures, and the architectonics is a bit doesn't look that good. And if we zoom in, we see that, yeah, indeed something goes wrong here. You can see here, like, for example, with the blue arrows, it's in like the immune cell infiltration. With the stars, they're like nuclei really smashed, the structure is lost, so you can see these necrotic areas. As well, you see expanded sinuses with the yellow arrows. And okay, what we can do it, and we decided to score it based on the certain 8 features that we decided were most important based on the other publications: congestions of those sinuses, fibrin deposition, the like immune cells, thrombi, necrosis. And indeed, we see that the placentas from the infected dams were the score, cumulative pathology score, which was much higher compared to the non-infected ones. And so this was our approach to histologically quantify all of this data. And afterwards, we decided, okay, what else can we do with that? Currently, there is not that much what you can do with hamsters. There's not much reagents that you can use. But so we checked for the virus in the placenta. We checked for the cytokines like MX2, IL-28, IP10, IL-6. We checked for the immune cells, for the CD8, CD4, and K cells also. And using all this combined, plus the placental weight, fetal weight, we followed the PCA analysis, this approach, and we have seen that at E10, we have 3 distinctive clusters of the placental fate and the fetal fate. And so this was around 6 dams. And so it's very different females, so and providing different fetuses with obviously different fates in that. And you can see here in this heat map that last is a viral RNA, and we see that the first cohort doesn't have the viral RNA, and but only the remnants of MX2. And if you go to the fetal weight, they were smaller compared to the other ones. Okay, no virus, still a bit of immune response, but they are small. Okay, let's check the second cohort. In second cohort, we still have virus, almost really calm immune response, and the weight is not affected. They are bigger compared to the guys that didn't have the virus. And if you go to the third cohort, we see the loss of inflammation and also the virus, and they're also small. Based on this, we can assume that it's not the virus that is causing all of this, but it's an immune response, probably triggered by the virus, that give all these detrimental effects on the fetal weight. Okay, we tried to do it also with a E4, the earlier time point when the infection happens, where we saw the biggest effect on the weight of the pups. And here we see 2 clusters. So, and the first cluster, first group of pups had high immune response, but no virus. So at this time point, there is no virus anymore. And yeah, indeed, they're much smaller than the others who did not have this burning inflammation in them, confirming that it's inflammation that makes it all these problems for the fetuses. So what does this model teach us? We have delayed body mass gain in dams. Their pups are small for gestational age. We have infection still in the acute phase, meaning like 5 days after infection, but it clears. And placental sustained innate immune response, like with virus or without virus. So what can we do to protect the pregnant female and their offspring? And we have checked for the what's happening with the humoral response to the infection without the vaccination. So in the first graph, you can see this total IgGs checked after the infections. So we see in monks they don't have it, what is expected, and at day 5 they already have some antibodies, and further in the later in the infection, higher and higher. Okay, but are those antibodies enough for neutralize the virus? So we do the inhibition assay, and we have seen that no. So even though that we have these antibodies, they are not neutralizing. And you see it, for example, in orange, this E4, they do have neutralizing antibodies, but at this time point, we have the highest impact on the body weight. So it's still not enough to protect the progeny. Maybe 15 days after infection, or we do have enough antibodies. We didn't see any problems at this infection time point. So we went for the vaccination. In our lab, we do have interesting approach to that. We have a vaccine based on the yellow fever 17D. So live attenuated vaccine in the pregnancy, you're not gonna prescribe for the patients. So the data is limited for that. But we did have the working yellow fever S0 star against the COVID that was working in the non-pregnant hamsters, and we tried to do that. So the seeds, here you can see that there are much more neutralizing antibodies in the vaccinated dams at the day 5. You see it here in the second graph compared to the non-vaccinated. So they already have this force, this weapon to fight the virus in that. We did vaccination in a prime boost regime. So we vaccinated them before the conception and then around 3 weeks before. And then we infected them at the E4. This when we saw the biggest effect on the progeny with the alpha strain. And then we sacrificed at the same time point. So everything was the same, just addition of the vaccine. And we have seen that indeed the vaccination is really beneficial to control the virus for the female. We see that it's where swabs and RNA in the swabs was much less in vaccinated dams compared to the non-vaccinated. So we could control it in this level as well in the lungs. The viral copy is much less, and the cumulative pathology score in the lung was better. So they didn't suffer that much because of the virus. So the mother is feeling better, okay, what we can see on the for the fetuses and the placentas, we do see the placentas are recovered. So the weight of the placenta is better, so they are bigger compared to not vaccinated, and as well pathology placental score is better. And you see here we could decrease the fibrin, thrombosis, and necrosis areas in those placentas, and consecutively we could affect the help to rescue the phenotype of the fetuses. So just generally, it's not the most vaccinology topic, but just to see how we can use this model. So pregnancy doesn't worsen SARS-CoV-2 infection in hamsters, but it causes intrauterine growth restriction. And poor fetal outcomes can be attributed for the placentitis, as you can see before, sustained immune response without the virus itself. And the prophylactic vaccination is the key to protect the pregnancy. And I would like to close my presentation with just showing that how important it is to properly communicate, properly investigate for example, the same vaccines. Because if you do some mistakes, it's really hard in the communication, especially, it's really hard to get the trust back. And you see it's that, for example, yeah, US is just a really special example, but where they want to stop vaccination of the kids. The pregnant women are not advised anymore to get the vaccination. And you have the outbreaks of the disease that should have disappeared already. And it's really important, for example, in the context of the pregnancy, is to include is a pregnant model or the pregnant woman in an investigation, and to be really careful and really effective in the communication of your results, because mistakes cost a lot and they cost life. And even though people do really cool science, there is a risk that nobody gonna use it afterwards. But with this positive note, I want to thank everybody involved and this opportunity to present my studies. Thank you so much.
Thank you very much, Yana. Your last words are very important, and I 100% share them. Thank you very much for adding these slides on the importance of communication in vaccines. I think it will be very important also once this presentation will be shared on our YouTube channel, and we'll have a bigger, more people that will see it. Thank you very much. So going to the QA, we have time for some questions. So for those following from home, you have a QA button where you can write and ask the question, and I will repeat the question to the speaker. So please don't hesitate to ask questions and don't be shy. So I will start with a question from Yana, for Yana. I was curious to know if you, like not you personally, but there are studies that shows this placentitis also on pregnant women?
Yes, there are studies. So it was nice to, I mean, not nice, it's not nice, but it was pleasant to see in the hamsters as well that we do see the same pathology in women, because this term was like proposed based on the human studies, because the placentas of taken from the patient, and you see all of this like the necrosis, fibrosis, and what else they see it, that's now also more data saying that it's like if the infection happens at earlier time point, like the first trimester and second trimesters, there are more risk to have the adverse like effects on the placenta itself. So, and also another thing showing that you don't observe the studies like these features in the vaccinated females. So there are lots of things to prove that it's working, and vaccination, for example, or COVID causes the placentitis. But yeah, it's hard to persuade people to change their opinions in that.
Yeah, especially if the government is saying otherwise.
Yeah, and like problem with the pregnant women is they're always, and like gynecologists, they're really conservative, because you know that lots of things are really negative or have a negative effect on the pregnancy, but some of them don't, and afterwards, like for example, Tylenol, the paracetamol, now is called like linked to the autism, and yeah, it's hard to do it because everybody's afraid of not only pregnant women but the babies.
Yeah. Thank you very much for the response. So then I have a question for Adrian. So the question is mainly about the importance of mentorship. So what are your suggestions? Because as we know, one of the problems we have is that once we get into a toxic environment, especially when students are young, then it's easy to repeat that behavior. So are there any suggestion on how to help students that have been through some traumatic or toxic environment to get them to behave in a non-toxic way? Is some kind of mentorship that you can suggest, courses?
Yeah, it's a great question. I think that there's a few different things in here that are worth unpicking. One of them it's certainly true that people don't start to be toxic for the first time when they're a PI or a manager. It is a series of learned behaviors that usually go quite deep into their history. And I think often it's not always intended to be toxic behavior. Now, sometimes it is, and the issue there is that if it actually is intended to be toxic or discriminatory, something like that, then those people are not going to reach out for help because they don't see it as something that they want to improve. The reality is that everyone is occasionally going to have behavior that is going to harm others. We can't be perfect all the time. We do need to be open to understanding that regardless of our best of intentions, we make mistakes. We have to be open to learning from that. And that's actually the critical thing. Once you're open to admitting that you handled a situation poorly, then you can go and get help. Now, in terms of mentorship, I think that we often think about mentorship as a model of the wise person that you go to, and then they teach you how to do things well. That model can work for some people. Most of us don't have that wise person that is always going to be there and that knows what we need to hear before we even say anything. The reality is that it's much more common to get mentorship through a distributed network. That you might have someone that you'll go to for one type of problem and someone else you can go to for another type of problem. And that's an easier ask to have a small bite-sized question for one person. And I think part of what makes that work is if you learn how to be a good mentee. So being a good mentor is tough, being a good mentee is tough as well. And I think the key to being a good mentee is to define for yourself what the problem is and what are the range of actionable solutions that are plausible for you, right? So, you can say, I'm in a toxic environment. Think for yourself in advance. Is leaving an option? Is it not an option? Am I willing to escalate things? Am I not willing to escalate things? Work out what are the parameters that you can operate on within this problem, and then come to the mentor with giving them all of this information. Okay, because mentors are much better at giving you advice when it is a distinct, actionable problem, rather than I'm really unhappy and I don't know how to fix things, right? Because that then puts onto the mentor to spend a lot of time to try to work out what the problem is. Whereas if you've done that work in advance and you present it to the mentor, then you can go straight to that productive discussion.
That's a very good suggestion. Thank you very much. I would add that sometimes it's difficult to find people that know that there is a problem, not only acknowledging, but like realizing there is one. Yeah. Makes it all more complex. So I will switch for another question for Yana. I think we can go for the last one. Unfortunately, I didn't manage to ask any question about the children books, but so we wanted to know what if is there studies that showed also development problems for the I mean, I don't know about the hamsters specifically, but I would go both for hamsters and or humans after this problem of placentitis. Are there studies showing that there are some developmental problems once the child or the pup is born?
If you have the placentitis, like in those images that I showed from the human cases, the fate of those babies was stillbirth, so they died, so they didn't have it. Like if you say development, meaning like the congenital malformations, we don't see it in any model because this is not the deforming congenital virus itself. But nowadays there are more studies like reporting that, for example, babies born from the infected, like pregnant women, have the high risk of respiratory distress, so they end up in the neonatal intensive care units as well. There are like more studies coming for the increased obesity, for example, or cardiovascular diseases. And I do believe there are much more going to be in the future, as it's like the neurodevelopment diseases, more like the attention deficit disorders or autistic spectrum, because yeah, if the infection itself also causes the maternal immune activation, and you have all this immune systems that bombarding the like fastly developing brain of the baby. So I do believe that more and more data gonna come soon. But nowadays it's already showing that cardiovascular diseases, obesity, or respiratory distress, but nothing like malformations that you would expect with Zika virus or CMV, where the brain is affected or the like limbs are not forming. So this we don't observe, and there's no data about it.
Okay, thank you very much. Well, I would say that respiratory distress and obesity are already sufficient problems that we might want to avoid. So yes, it's 5. So thank you very much. Those were two very interesting presentations. I had a lot of fun sharing it. And yeah, so there will be on YouTube in the next, usually take 1 or 2 months to get them on, especially because now we have the conference. So, but we are very excited to get them online so that we can have more viewers, because I think those two presentations should be shown as much as possible to the world. So thank you again. And I hope to see you soon around. And thank you also to all our attendees. And see you then next month, the 13th of November at 10 a.m.
Thank you.
Bye-bye. Thank you. Bye-bye.